What's up, beautiful people? Another day, another study. Knee arthritis affects over 360 million people worldwide, and over 50% of the people who have knee arthritis are overweight or obese. And we think obesity-associated osteoarthritis is caused by excess weight bearing on the joints, systemic inflammation, and impaired lipid and glucose metabolism. And these things accelerate some of the structural problems with osteoarthritis, cartilage degradation, and then disease progression. Metformin is a drug that's been used for over 60 years. It's associated with improvements in insulin sensitivity, inflammation, glucose and lipid metabolism, as well as a small reduction in body weight. There are animal studies indicating that metformin may be effective for osteoarthritis. We also have observational trials showing that there may be an effect there as well. This was a small randomized controlled trial looking at 6 months of metformin compared to placebo for reducing knee pain in overweight or obese participants. Now, the second part of the study would have been very interesting, where they actually wanted to look at structural markers of cartilage, but they weren't able to do so because of funding. But in this study, they compared 2,000 milligrams of extended release metformin once a day to placebo. And the main thing that they measured was knee pain on a visual analog scale. And the metformin group saw a greater reduction in knee pain compared to the placebo group. And the effect size here was moderate. So that's a pretty good treatment. And if you look at the effect sizes they saw, it was actually a little bit higher than the effect sizes you see with NSAIDs, a type of medication like ibuprofen or Aleve that's often used for knee arthritis. There was a modest weight loss of 1.8 kilograms in metformin group versus 1.2 kilograms of placebo group. In a secondary analysis, which is really exploratory because they weren't able to do the full study that they wanted to, they did see improvement in WOMAC scores for pain, stiffness, and function, and these were seen at 6 months, but not 3 months. There are significant limitations. This was mostly telemedicine due to COVID. It was a short duration. They excluded severe osteoarthritis and severe knee pain, and there were no objective measures of function. But this study adds to the overall data showing that osteoarthritis is not just a joint issue, but is also a metabolic issue. I had talked about previously a study with GLPs that showed improvement in knee arthritis as well. And both of these medications, GLPs and metformin, improve insulin sensitivity, improve lipid and glucose metabolism, and have anti-inflammatory effects. All of those things are associated with metabolic health. So in order to treat osteoarthritis appropriately, we have to look at metabolic health